The information discussed by the host and guests on this talk show is meant to be informational only. Listening or calling in to ask questions for our guests does not create a patient-doctor relationship. Rely on your own doctor or healthcare provider's medical advice to treat or diagnose any conditions you may have. Nothing discussed on this talk show is meant to replace your doctor's medical advice. You should never stop your current medical treatments or delay getting medical treatment because of anything presented in this program. If you want more information about a medical condition or treatment discussed on this program, talk to your doctor.
It's time for Health Check with Heidi Godman, a daily dose of health and wellness information. Call or text Heidi your questions at 373-1220. That's 373-1220. And now here's Heidi Godman.
Hi, everybody. Welcome to Health Check. I'm Heidi Godman. Hope you are doing well on this great day. We have a very interesting program lined up for you today. In a little bit, we are going to be talking in our weekly Brains Boost about a different way to look at pain management. Scientists have discovered nerves attached to even the teeniest places in your body, and it might surprise you. We'll be speaking with Dr. Dean Sutherland, our local neurologist, a little bit later about that. But we are going to start today by talking about your skin, one of the most important organs in your body that is probably also one of the most overlooked. My guest is Dr. Manjula Jegasothy. She is an aesthetic dermatologist trained at Harvard and Yale. She's the founder and owner of the Miami Skin Institute, and she's a regular here on the program. Good to have you back, Manjula.
Thank you so much for having me again, Heidi.
Hi. So people really do tend to overlook their skin, especially when it comes to simple things like dry skin. Tell us about that.
Sure. I think also it's important to make the distinction between dry versus dehydrated skin, because most people use the terms either interchangeably or they just call everything dry skin. Dry skin is actually a lack of oils or lipids in the skin and is caused by some kind of disorder in the skin, meaning some sort of inflammation or maybe a pre-skin cancer or an actual superficial skin cancer itself, or those kinds of things that need to be treated. Dehydrated skin is simply a lack of water in the skin, which can be atmospheric if you're in a really dry area, or if you're actually dehydrated throughout your body, it manifests in your skin if you don't have enough water in it.
Which is the more common? Is it the dry skin or is it dehydrated skin?
It's a dehydrated skin. So most of us, when we put on moisturizer, we are treating dry skin because that's got lipids. But most of the time, it's really a lack of water. And so, you really would be remedied better by, drinking more water and being more hydrated overall and, being in a more humid atmosphere. We have a little bit less of that problem in Florida than most places.
Yeah. How does the humidity affect that?
I mean, it definitely, anyone will tell you who has a tendency towards dry or dehydrated skin, we'll say dehydrated skin, or we can even just say the symptoms, scaly skin, pruning, that sort of thing. In the northern cities or out west, will tell you that in Florida, their skin seems so much better.
All right. What about dry skin? How would we know the symptoms of that?
So the symptoms of dry skin tend to be, like I said, wriggling or fine pruning of the skin, and thinning chronically of the skin, and then also an actual, if you can see the kind of scaly appearance of the actual skin cells on the surface of the skin when there's not enough water in the skin.
All right, so maybe they're sloughing off, or you can see that ashen kind of a look.
That ashy thing is exactly right. Darker skin people, yes.
Okay. Is it possible to have both dry skin and dehydrated skin?
I think it's quite common. I think that people who have dehydrated, or who have dry skin because they have an inflammatory condition such as mild eczema or psoriasis, rosacea, or anything, any of those common things that are inflammatory, tend to also have disruption of the stratum corneum, which is the top layer of dead skin cells, which is the barrier the skin has against the atmosphere. That tends to be disrupted, people with inflammatory skin issues, even if you have a pre-skin cancer in an area or keratosis or any of that. And that can cause to lose moisture through that part of the skin, and so then it also becomes dehydrated.
Now, what about what you can do about these things, especially when you mix aging into this picture? Because aging affects the skin too. How does that play into it? And then what are your options?
So aging and, of course, sun exposure causes DNA damage to the skin cells first before anywhere else, and then that causes an inflammatory reaction, which then causes dry skin, which is a loss of oils. The dry skin and the inflammation then causes moisture loss, which then becomes dehydrated skin. So obviously the best thing is to avoid the sun as much as possible, but we can't prevent aging. So it's a really good idea for everybody to obviously be hydrated, to drink their 8 glasses of water every single day, and to, put moisturizer or lip on the skin, as often as necessary to keep the skin looking full and moist.
All right. So what do you want to look for in a good moisturizer? And does it matter if you have any particular skin conditions?
Yes. So if you have a skin condition, it becomes a little bit more complicated in terms of picking a skin moisturizer that doesn't cause more inflammation or burn or sting or cause you to be red. Certainly, there's been a lot of studies done lately on the lipids called ceramides, which is ceramide, and those they mimic the skin cell layer, the lipids of the skin cell, and they're commonly found in a lot of drugstore moisturizers. Ceramides, and Episerum is one, and there's a bunch of them. I think even Cetaphil now has ceramides in it. So that's one thing, and that the sort of common drugstore moisturizers that have been around for years all have oils in them and lipids in them that make the skin wear, whether it's Nivea or Olay or Lubriderm or even old-fashioned Kerry lotion. All of those have the right kind of lipids, and they tend to be fairly fragrance-free, so they do not disrupt people's skin, even those who have sensitive skin or skin issue.
But is it really absorbed? I mean, and does regular use of moisturizer start to change the look of the skin, or does it just make it feel better?
It's not really absorbed, and nor do we want it to be. It is that it sort of intercalates. It's sort of those oils come and sort of blend into the skin, the outer skin cell layer, to trap moisture and to reduce inflammation. We don't want it penetrating beyond that, because we like to then go and do actual, drug type work in the skin cell itself to cause either inflammation or cause the skin to reproduce or to do anything. We just want it to be on the skin cell layer. Now, in the short term, it just makes it look nice, supple, and hydrated, like I said. Chronically, if you're using moisturizer on your dry or dehydrated areas, which are particularly the rough skin, the knees, the feet, if you do that for some women, certainly the V-neck, the shoulders, over time, chronically, you're going to reduce chronic inflammation from aging in the sun, and you are going to have better skin overall. It does. That's right. It's no accident that whenever FDA studies a new capital drug, they always have put it against its own vehicle or placebo, its own moisturizer that it's in. And we all find that people's skin improves a lot just from using the placebo or from using the moisturizer that it's in. So there's a definite, difference in your skin if you moisturize daily.
Okay, well, that's very encouraging, and we have much more to talk about. So everybody, please stick around. More with Dr. Manjula Jegasothy in just a minute. This is Health Check with Heidi Godman on WSRQ. We will be right back.
At Doctors Hospital of Sarasota, you're more than just a number. Our exceptional and personalized approach to your care starts the moment you arrive. Our new and expanded emergency room has the shortest wait times in the area, so we can serve you faster and better. And our expert emergency room team is committed to putting you and your concerns first. Plus, we take most insurance plans. Doctors Hospital, at the corner of Bee Ridge and Cattleman, caring for you.
Welcome back to Health Check. I'm Heidi Godman. If you're just joining us, we are talking about skin today. My guest is Dr. Manjula Jegasothy, who is a Harvard and Yale trained aesthetic dermatologist. And she's also the founder of the Miami Skin Institute. We have been talking all about dehydrated and dry skin. Now we want to switch gears a little bit and talk about skin acne. And this is something probably you might associate with teenagers, but can it happen to us at any age, Manjula?
Yes, absolutely. I mean, it happens most in teenagers because a lot of that, and particularly in boys, is testosterone mediated, and that's when testosterone levels are climbing in both genders very rapidly, and so that's why we tend to see, we call it back acne or backne, and then sometimes it's on the chest as well. But it can be seen in any age due to hormonal fluctuations that affect the testosterone levels.
How do you know if it's just a little breakout, a pimple here and there, or if it's acne?
I'd say if you're getting more than 3 new pimples a week, it is, quote, acne and probably requires some sort of prescription care.
Are there different levels of acne? Is there mild, moderate, severe?
Yes, definitely. We characterize, as dermatologists, we characterize, between 1 and 5 new pimples a day as mild acne on a given area. So face, back, or chest. Each 1 to 5 is mild, 5 to 10 is moderate, and more than 10 a week is severe.
And are there certain triggers for this acne? I mean, obviously, if you're a teenager, maybe it's the surge of hormones. What about as you get older when the hormones change again? Or what about just being active and perspiring?
Being active and perspiring can be an issue, but that acne tends to sort of manifest more as clogged pores, so whiteheads or blackheads, and then maybe even a few pustules, very superficial bumps that actually have white fluid in them. The deeper underground, under the skin surface, cystic-looking pimples that you can't extract and have no opening to the surface are the ones that tend to be hormonal. They also tend to be either more itchy or actually painful, and you can't, the patient can't press anything out of them because they're underground, they're deeper. Those are the ones that we're talking about. And in women, they can manifest in sort of any and every decade as their hormones change with each new phase of their life, whether it's their peak childbearing years, whether it's they're pregnant, whether they're post-pregnancy, postpartum, whether they're lactating or breastfeeding. Each of these things is a hormonal upheaval that can cause body acne. And then, of course, the final big push is premenopausal, and then menopausally even, you can have one last sort of hormone surge or hormone fluctuation that can change your testosterone levels and then give you, one last few months of body acne.
What about older?
Now, with men, it's different.
Oh, okay.
With men, in general, if they're past 13 and they have a sudden onset of body acne, I always ask if they're taking creatine supplements or protein supplements, or if they've been lifting a lot of weights lately and doing some kind of thing in terms of, raising their testosterone levels, because even the act of building muscle bulk builds testosterone levels. And then many of these supplements, even though they don't say it, have a small amount of different testosterone-related compounds in them.
All right. So it could be something that you're taking, so you've got to be mindful of that. And then what about diet? How does that play into it?
I think that we know that, anything that contains hormones such as non-organic meats, especially non-organic chicken breasts, and then dairy, whether it's organic or non-organic, all milk has hormones because the cow has to give hormones to the baby cow to grow, so that all has hormones. So that can affect you and also give you body acne. But I tend to find that this kind of body acne is less related to diet than facial acne. I think this kind of acne in men is often related to weightlifting and supplements, and in women it's due to the changes of life.
Okay. And then what about people in much older age? Is there good news there? Do you not have to worry about that?
again, as men, unless you're continuing to bodybuild and take supplements, then it tends not to become an issue after age 40. With women, very few women have that sort of perimenopausal surge. So with most women, this tends to stop being an issue around 35.
Okay, so that is something that everybody can at least take a little solace in, that maybe when you're older it won't be as big a problem as when you're younger. What about the pitting that sometimes comes along when you have facial acne? It can leave scars and things like that. Is there a similar situation with body acne?
Yes, and in fact, with body acne, those deeper cysts tend to be larger. They can be anywhere from 3 millimeters to 7 or 8 millimeters. And so when for example, some dermatologists inject them with a little cortisone to make them go away faster. If they go away really fast, the space they leave behind can be a pit that can last for, up to 6 or 7 months. Some of them actually leave an indentation in the skin, which is what we call a pitted acne scar. And those often require either treatment, they're permanent if they're not treated with either a little bit of filler or maybe Fraxel laser. There's different ways to treat them. I think in the future, lasers, the light laser resurfacing such as Fraxel is going to become increasingly popular to treat these kinds of scars.
All right, so let's talk about treatment if you do have a breakout before you get to the scarring point. What should you do?
If you have, like I said, probably, you're getting more than 3 new pimples a week in a given area for a sustained period of time, meaning more than 3 weeks, so a month, I would say you need to visit your board-certified dermatologist.
And then what happens at the dermatologist?
They'll evaluate you, and, if it's sudden, they'll definitely ask you about if you're taking supplements or newly bodybuilding, whether you're a man or a woman. Generally we might check to make sure you're not pregnant if you're a woman. If there's a reason for it, such as you've recently been pregnant or you are pregnant or you're breastfeeding, then we'd attribute it to that and generally not do any prescription treatment, because pregnant women and breastfeeding women we don't do prescriptions for. But if you're not and there's no other reason, we may check a hormone panel or send you to the gynecologist or to your primary care doctor to get a hormone panel, depending on what your insurance will cover. And then we would start treatment, and we might start with topical treatment, such as retinoids or benzoyl peroxides that are prescription strength, or even this medicine called Axone, which is popular now, which is kind of an antibiotic-type topical treatment. We might give the patient oral antibiotics, probably the most popular of which is doxycycline right now. Or in women, we've been finding that spironolactone is quite effective for this kind of hormonal and body acne. And then, as a last resort, obviously Accutane, which is the generic name is isotretinoin, and that's something we give, if people are fairly moderate to severe and don't have any other reason for having it, and other than genetics and, their hormones, and so they need relief.
And some of those things that you're mentioning, actually a lot of those things are the same types of treatments that you might prescribe for facial acne. Is it in a stronger concentration if you're trying to put it on your body, or is it just the same?
In a higher dose, perhaps, yes. And then also, we are probably more equipped to jump to the oral medications when it's body acne, because obviously it's very difficult to get the topical medicines onto areas, large areas, and then onto areas you may not be able to reach as well, such as the back.
All right, so then the oral medications include the low-dose antibiotics, but there's such a push right now, especially from the World Health Organization, to stop using antibiotics. And what about these long-term use antibiotics? Is there any concern there of antibiotic resistance developing?
I mean, there's a lot being written about it. There's certainly a lot in the dermatologic literature about it. The answer is, we don't know. We have been using these antibiotics fairly, semi-chronically in certain patients for years. Yes, you have to balance the pluses and minuses. This is an individual patient who's suffering with their acne. They can't go out. They can't wear a tank top. They can't go to the pool, etc. Versus, the world at large, and I don't know the answer to that. That's like recycling or not to recycle as an individual. Do you think your own personal recycling really helps the planet? I don't know. So in general, I'm a dermatologist, and so if my patient is suffering with their acne, I'll give them the antibiotics, and I'm not as concerned about worldwide resistance. I'm hoping we will keep coming up with new antibiotics in the pharmaceutical companies, and so we won't have this problem.
Okay. All right. Well, we don't have to solve this worldwide problem today. Maybe
Yes.
next time. Maybe next time we can solve that. But we just have 2 minutes left in this segment. Tell me a little bit about what you can do, again, if someone does have scarring from body acne.
Sure. In the beginning, the scarring is often pink or red, and so that's when it's best and most easily treated with the vascular laser, which kills the blood vessel feeding the scar, and then that really remodels the scar very quickly and easily. So if you are getting scars from your acne, it's a good idea to get them treated fairly soon, and I'd say, though, to wait until your acne is being treated, too, because it's kind of a waste to treat an individual scar and then get a new one the following week, etc. So wait until your acne has been controlled and you're on treatment. And then I would say as soon as possible after that happens, go and get laser treatments. And it might be just the V-beam laser. It might be just the Fraxel laser if their skin colors, these pitted scars, or it might be a combination of both lasers.
Okay. Great information as always. And if someone wants to know more, how does he or she get a hold of you?
Absolutely. We're being very active right now on Instagram. The handle is at Miami Skin Institute. Almost all of the topics we discuss here on the radio show are on my Twitter feed, which is at Miami Skin Ins. And then you can find us on our iTunes channel, our actual podcast of these radio shows of Health Check with Heidi Godman.
Fantastic. Okay, so many ways to get a hold of you. And again, a quick reminder about the website.
www.miamiskininstitute.com.
Terrific. All right. Thank you so much. And don't go anywhere, Manjula, because we want to keep asking you for advice. But everybody listening, we need to take a quick break for news and weather. When we come back, Manjula is going to tell us how sleep affects your skin. This is Health Check with Heidi Godman on WSRQ. More with Dr. Manjula Jegasothy in just a minute. Hi, I'm Heidi Godman from Health Check, and I want to talk to you about a real problem for older adults here on the Sun Coast: isolation. Seniors who no longer drive are often isolated. They don't have contact with the world outside their door. They can't get to a doctor's appointment or even a grocery store. But the nonprofit group ITN Suncoast provides safe, affordable rides for seniors so they don't have to be isolated. And you can help by becoming a volunteer. For more info, visit itnsuncoast.org or call 941-364-7530. Welcome back to Health Check. I'm Heidi Godman. We are talking today with Dr. Manjula Jegasothy. She's an aesthetic dermatologist trained at Harvard and Yale, founder of the Miami Skin Institute. And we are going to talk now about how sleep affects your skin. And my goodness, Manjula, it seems like sleep is so absolutely crucial to every aspect of health, but people probably aren't connecting it with skin health.
Yeah, it's exactly what you said. It's like every study that comes out today is something different about how sleep is important for our lives. I think, most important is how it affects the immune system, and we think it affects the tumor surveillance system of, portion of the immune system the most, so cancer prevention. So it's the same for skin cancer as well. If your immune system is operating at, top level, then you're most going to be less likely to get skin cancers as well. So that's one thing. I think most people who actually, are worried about how they look from day to day and all of that know that when you don't get enough sleep, you have those dark circles under your eyes. So that's one thing, and we think that's due to the fact that blood vessels are dilated when you don't get enough sleep, perhaps from hormonal factors, from lack of sleep, or perhaps just from, not enough blood to the face from being tired. We don't know the answer, but we do think the darker circles get worse under the eyes with lack of sleep. It might be simply dehydration of the skin from lack of sleep. We think that not sleeping enough robs your body overall of hydration, and so maybe the skin is thinner, and so you have dark circles. But I think something that people overlook is that when you don't get enough sleep, your circadian rhythm, which is governed by cortisol levels from the pituitary gland, becomes off. So it's not having the normal cortisol high that everybody experiences generally right before dawn, around 4 or 5 in the morning, and then the cortisol low that everybody is supposed to experience around 4 or 5 in the afternoon before sunset. That was how we have been hardwired. And if our sleep patterns are off, or if we're not getting enough sleep, it changes that circadian rhythm and their cortisol levels. And I think more than anything, that then affects all the hormonally mediated skin conditions, whether it's acne, rosacea, or inflammatory conditions, and then aging as well.
Okay, so every aspect of your skin could be affected by a lack of sleep, let alone all of the other health conditions that are associated with sleep deprivation, fuzzy thinking, and so many others. So this is very important to get sleep. But if you are waking up with some of these skin conditions that maybe you're linking to sleep, are there any fast fixes?
There's always a fast fix with makeup, women, obviously. Other than that, if you're not having enough sleep, the worst thing to do, I think, is to drink a lot of caffeine or coffee, which is what most people do, because that constricts the blood vessels and then causes the skin to get pale, might cause it to sweat. It makes it actually look worse. So, in my opinion, the best thing to do if you didn't get enough sleep acutely is to hydrate well, drink a lot of water, eat healthy foods, eat foods that are high in vitamins, vegetables, cold pressed juices, etc., to get yourself through the day without too much caffeine, and then recalibrate, get a good night's sleep, and try to do that every single night.
Now, have you really seen a difference in some of your patients who then do get a lot of sleep and then suddenly have an improvement in skin, or is it something that you wouldn't really notice right away?
I think, it's a lifestyle habit, just like eating properly and not, eating bad food. I personally have gotten 8 hours of sleep every night for my entire adult life. I'm a big sleeper, and I'm a big proponent of sleep. And I think it's overall made me look a lot younger for my age. I think it's made my skin just much better than if I hadn't.
And what about collagen? Is there any link to sleep and collagen that we know of?
We haven't been able to link it directly. The study would have to be done where we compared people who had a lot of sleep versus people who didn't get a lot of sleep, and, then taking biopsies and then measuring collagen levels. And then the whole concept of what is a lot of sleep is different for different people. Everybody recommends around 7 hours of sleep. But there are certainly some people who it is normal for and fine to only get 5 or 6 hours of sleep. There are not that many where it's enough to only get 3 or 4 hours of sleep, but there are a few of those people as well. And then there's some people that really do need 8 hours of sleep. So it all depends on you also. Most people individually know what is the perfect amount of sleep for themselves.
Sure. All right. So sleep absolutely is necessary for great-looking skin, but also the other lifestyle factors, as you're mentioning. You need a good diet and also exercise. What's the link between exercise and healthy skin?
I definitely think that exercise causes bigger dilation all over the body, causes the blood vessels to open up, and then that delivers your nutrients and oxygen, all the things that are crucial to skin cell health. It delivers it a lot more efficiently, so it makes your skin look a lot better overall.
Okay, so you want to make sure that you're getting enough sleep, you want to exercise, and you want to eat a healthy diet. And refined carbohydrates probably should not be part of it. I mean, we always say that you should get rid of the prepackaged foods and the refined carbs just for health overall. But especially, you would include your skin.
Yes, I think everything is healthy for the body overall, reflects in this largest organ of the skin.
And then we've got to talk, too, about another lifestyle choice that people make, and that's smoking. And what impact does that have on skin?
Smoking is perhaps probably the worst thing for the lungs, and then second, the skin, because it vasoconstricts on a constant basis the blood vessels that feed the skin. So therefore, those people get a lot less nutrients and oxygen delivered to the skin. So acutely, it can cause them to have inflammations and all of that, but then chronically, it gives them much more wrinkling, much more susceptibility to DNA damage from the sun and aging, and then that sort of grayish pallor that you see in smokers as they get older is because they've had chronic lack of oxygen to the skin.
And then there are also particular lines associated with smoking in the face, right?
Yes, and that's the action of smoking. To purse your lips chronically like that in order to smoke gives a lot of people what we call those smoker lines, which is those tiny vertical lines that extend from the border of the lip upward and outward and downward across from the lower lip as well, smoker's lines.
Okay, so the good news is that if you decide to live a cleaner life, if you quit smoking, if you're eating a better diet, if you're exercising, if you're getting the right amount of sleep, doing all the things that we need to be doing for good health anyway, then the side benefit is that your skin will start to look better.
Indeed, and I think I would advocate that for everyone to live a happier and healthier life.
And then, I also forgot to mention stress reduction. That's got to play a big part in it. Tell us about that.
So stress is all about cortisol. Stress itself raises your cortisol levels artificially throughout the day. It can do that several times a day in spikes, or it might do that sort of chronically where it's elevated all the time. And that elevated cortisol is the same as upsetting your circadian rhythm with bad sleep. And so that can cause inflammatory disorders, related hormonal disorders, and then, eventually suppress the tumor system of your immune system and can cause cancers.
Okay, so stress reduction, eat a healthy diet, exercise, stop smoking, so many things that we need to do and get the right amount of sleep, and then we'll all look fabulous and we'll never need dermatologists again. But no, that's not true because so many things can go wrong, and thank goodness we have wonderful dermatologists like you, Dr. Manjula Jegasothy. Thank you so much for being on the program today, and tell us how we can find out about you.
Thank you so much for having me as always, Heidi. I enjoyed it. You can find me on the web on my WordPress blog, which is Miami Skin Institute, on my website, miamiskininstitute.com. I'm on every social media platform. Facebook is Miami Skin Institute, as is Instagram. On Twitter, I am Miami Skin Ins. Pinterest, I have all my before and after pictures posted at Miami Skin Institute. And then Heidi and I have a podcast together on iTunes under Miami Skin Institute.
All right, fantastic. Always good to talk to you, Dr. Manjula Jegasothy. Thanks so much for being with us today.
Thanks again. Bye.
Right, bye-bye. Okay, everybody, we are going to take a quick break. When we come back, it'll be time for our weekly brain boost. This is Health Check with Heidi Godman on wonderful WSRQ.
The sun is out, the kids are playing. It's all fun and games until someone gets hurt or sick and needs urgent medical care. Sarasota Memorial's 6 urgent care centers are staffed with board-certified emergency and family medicine physicians, so you can count on the best care, fast. The right doctors right away at Sarasota Memorial Urgent Care Centers. Open daily 8 a.m. to 8 p.m. For locations, visit smh.com/urgentcare.
Welcome back to Health Check. I'm Heidi Godman. So glad you are with us today. We are talking now about brain health. Our guest is Dr. Dean Sutherland, and we're talking specifically about a discovery that could eventually help design new approaches to pain therapy. And Dean, I guess you could say that we're sort of a hair's breadth forward in the quest to find better pain management.
That's right, Heidi. That's hilarious. So this is a really interesting paper. Sometimes we talk about esoteric and odd things, you and I, but this is actually has some sort of clinical application, as we'll talk about in a minute. So at National Institutes of Health, there's a group of researchers who study pain receptors, skin receptors, and also the brain cells that are associated with those. So what these people have discovered, something that was not known until recently, is that each little hair follicle has a nerve fiber that wraps around it in kind of a cylindrical manner. And whenever you pull a hair or pluck it out, you get that really sharp pain. That's why that happens. We weren't quite certain why it was so painful to have a single hair plucked or pulled out until this time. The reason why this is important it's more than just a fascinating fact. It's actually important because there's different types of pain. And as you and I have discussed before, pain management is a big deal these days because we don't want people on narcotics all the time. And there's sometimes narcotics don't work for certain types of pain. There are medications that can be used for burning or stabbing pain or aching pain or things like that. But the more tools that we can have to try to treat someone in chronic pain, the better off we're going to be in the long run. So one of the things that we think may fall out of a study like this is that the brain cells that we're looking at in this study actually have different genes that get activated when a hair is pulled, when you get that sharp stabbing pain from a hair being pulled. So it's not just a matter of the actual nerve in your skin being activated, it's also the brain being activated. So ultimately, if we could figure out some way to turn down those brain cells that are experiencing that sharp stabbing pain in that area of the brain by, say, it could be a drug or it could be a protein or a monoclonal antibody or something like that, then again, we might be able to help people manage those burning sort of pain better. And you can get that kind of pain from things like a burn injury, skin tears, and some types of rashes, including shingles and things like that. So that's a whole category of pain that can be very debilitating to people.
So how could something like this lead us to these new treatments or new approaches to treatment? I mean, now that we know there are these new sensory neurons involved with pain that we weren't really sure about before, how could that give us another leg up on treating pain?
Well, as I was saying, these particular sensory fibers, they go into your spinal cord, into your brain, and they activate genes in your brain that are associated with that type of pain. You heard of recurrent pain syndromes, right? If you have a pain that continues for a while, it's almost like your spinal cord and your brain expect it to happen. And that's what happens with post-herpetic neuralgia, which is shingles pain that goes on and on for years at a time. So if we can figure out a way to turn those genes down so that doesn't happen, then that would be a big leap forward just in treatment of pain management without having to use, again, narcotics or drugs that are very sedating.
So step one is find out which sensory neurons are involved in it. Step two is then figure out how to quell them.
Exactly. If we can activate or deactivate genes in those neurons in the spinal cord and in the brain, we may actually be able to affect the whole quality of the pain and maybe even turn it off completely.
Okay. And as you're saying, that could be very important not only for people who have all kinds of pain, but especially people who have burns or things like that, which are very difficult to treat. And then what can we do right now before all these discoveries lead to new approaches? What is available right now to treat different types of pain?
Well, we are kind of swinging back more towards less medicinal uses, medicinal preparations to treat pain. And by that, I mean we're trying to get people to deal with their pain more on a psychological basis if possible. As we've discussed before, back pain is often actually treated best with just some Tylenol, time, and then also activity and kind of adjusting to a little bit of back pain. Everybody has a little bit of back pain. Some people have more than others, of course, but using less and less actual sedatives and narcotics is kind of where things are headed with that. So when you initially get an injury, of course, you want to assess it and make sure it's not something that has to be addressed by a doctor or an emergency room. But if it's really more of a minor sort of injury that can be seen later on down the line if it continues, then you want to do things like when you first get an injury, you want to put cold on it, so that the inflammatory cells don't get out of control. And like, let's say you bark your shin on a brick or something like that. It's best to put something cold on there first, and then later on, days later, you could actually put warm compresses on there, and that may actually help reduce the pain in the long run. Tylenol is pretty good for pain. Anti-inflammatories like ibuprofen or Motrin are also good, but if you're bleeding a lot, like say you have a hematoma, then they can actually sometimes contribute more to those. But in the short term, they're probably safe.
Okay, so there are a number of things we can do in the short term. But then for long-term pain, I mean, that's where all of these opioid problems have been creeping in. People have chronic low back pain or something, and surgery hasn't fixed it, and nothing is fixing it. So there is something that really can go a long way toward that, and that's exercise, right?
Exercise is very helpful. Exercise releases dopamine in your brain and in your spinal cord. And dopamine is not just a movement neurotransmitter, but it's also involved in the pain system and pain modulation. And so exercise does help, and it helps for that reason. We kind of think of exercise as medicine in terms of that. Also, with exercise, you get more flexibility and strength, and you're less likely to exacerbate the pain. And that's true a lot of times for back pain. One of the problems with back pain can be flexibility. If people don't exercise, they don't stretch, and then when they try to do something that they haven't done for a while, that's when they really get into trouble. So keeping on top of that, and even seeing a physical therapist is often very helpful along that same line.
Sure, and then if you can bulk up the muscles, then they can help absorb some of the pressure that you're placing on your body, and that can help reduce pain, and so can losing weight. Tell us about that.
Very true. So anytime that you have increased weight, especially if you have belly weight, regarding back pain, that puts extra pressure on your lower back. The same is true for knees and other orthopedic issues. So overall body weight does play into it. Most people in the United States, we think, are probably a little bit overweight, just on average, and some people are very overweight. But clearly, if you can reduce that, then that plays into the whole thing. And exercise goes a long way towards helping with that as well.
Okay, so a lot of different types of pain, obviously, from a lot of different kinds of sources. But overall, it sounds like we have some short-term ways to treat it. It's the long-term ways that have been so challenging. And that's why there's this big push, as you say, to find pill-free ways to treat pain. But if we do have these studies that are identifying different sensory neurons that are turning pain on and off, and maybe we get more treatments down the road, is that possible one day that opioids will be a thing of the past?
I suspect not. I suspect there will always be people that will need to have them at least at certain times. For instance, after surgery, if you treat somebody during surgery and after surgery with opioids for a day or so, you actually reduce the likelihood that they're going to have pain down the line. It's when you give them opioids, weeks or months after whatever happened, that's when you get into problems. So I think opioids do have their place, but they have to be used very sparingly.
Okay. And then there's just so much to know about it. So thank goodness we have great physicians like you to help guide us through. And if someone is interested in finding out more about you, Dean, and what you do, how would we find out?
They can call our main office number. We have an office over by the main hospital at Sarasota Memorial Hospital. And the number is 941-487-2160. Or you can go to our main website, which is Jegasothy, Sutherland, and Haynes Neurology.com or nshneurology.com.
nshneurology.com or 487-2160. And this is a good time, actually, to call and try to get in to see you as opposed to the rest of the year when it's so crazy, right?
That's right. October 1st is coming. All these people are going to be coming back into town.
All right. Well, I want to thank you so much, Dr. Dean Sutherland. Thanks for being on the program. Always good to talk to you, and I hope you stay pain-free for the rest of the day.
Thanks, Heidi.
All right. Thank
Bye.
you, Dean. Everybody, again, that's Dr. Dean Sutherland. He is a very prominent neurologist here on the Suncoast, and you can talk to him too. His number is 487-2160, and you can reach him, if you want, by checking out his website, NSH Neurology. He and his partners talk about all different kinds of healthcare issues and treat all kinds of healthcare issues. So if you're interested, you can talk to one of the 3 neurologists there at nshneurology.com. All right, that'll do it for us. I'm so glad that you tuned in today and took some time to be with us. It's very, very interesting to talk to all these healthcare professionals every day, and I'm so glad that we get to share it with you. So thanks for doing that. Thank you so much to my wonderful producer, Luke Roseborough, who is the doctor of radio. And you've been listening to Health Check with Heidi Godman on WSRQ. Hope you have a great day, everybody, and we'll talk to you again tomorrow. Bye-bye.